Okay. Very good afternoon to all of you. Angie, venerable from Buddhism and other religious faith. I'm very honored to be here to talk about mindfulness. Before I start the talk, may I have a show of hands? How many of you have heard of mindfulness? Okay, only one. Okay. All right. I think almost all of. How many of you have have been practicing doing some mindfulness practices like meditation, mindful yoga, or any form of things that have certain mindfulness inclination element? I'm sure our venerable also, but too humble to. Okay, good. All right. So for those who have done, you go back, continue to do the job, do your mindfulness practices. For those who have not, just sign up with Brahm Center, and that's the end of today's talk. Okay. Actually, when NG asked me to give a talk, something on some psychiatric topic, I said, very sienna. Everything I talk about, depression, anxiety, stress. I said, why not? I give a short talk on mindfulness-based cognitive therapy, because I just came back from UK. Our government very good to public hospital doctors nowadays, selling a little bit goyo. They actually gave me money, sponsored me away for 6 weeks to go to UK, one of the University of Exeter, quite famous, one of the 3 major centers for mindfulness-based cognitive therapies. And let me go there, sit and do nothing, and have a lot of cream tea. So I told Angie, let me just do a bit of sharing and sell a little go your MBCT, 1 hour talk. But at the end, she bounced back and gave me a 2.5 hours slot and tell me to do a workshop. I say 2.5 hours, I'll do a workshop, a bit tough for me, especially with a crowd of 200 people. But I'll try my best. Okay. So I titled this today's topic as mindfulness for everyone. Actually, now everybody is jumping on mindfulness bandwagon, right? Just now Angie showed on a slide. Even the Time magazine said that this is the century for mindfulness or something like that. And everyone want to do something about mindfulness. But actually, exactly what is mindfulness? What does it entail? Does it work? And who have been doing what? And even, I think not only, probably Singapore, we are a bit behind the time curve for many of these things. But when I was in UK, before the 6-week attachment at Exeter University, I've attended some of the conference for mindfulness. It's a international mindfulness conference that's been going on for many years. And in Massachusetts, where MBSR, later we'll talk about what is MBSR, some of you may have heard of. This is a regular event where thousands of people actually attend. So it's quite a big thing. So today, for those of you who have not heard of mindfulness, which is only a handful of you, maybe my job here is try to help you to have a better understanding of mindfulness. Try to, okay? And of course, 2.5 hours, ask you to sit here and don't take home anything, then you say, wow, waste of time. Because I heard feedback of one of my good friend who give talk, he said, he received a feedback that he was giving a lot of picture or things about clinical feature of conditions, but he did not tell them how to cure the conditions. So, but anyway, I'm not here to teach you how to cure yourself of depression, anxiety, stress-related problems, or anything. Please go and seek help from your doctors. Otherwise, we doctors will be out of jobs. But I will share with you some simple mindfulness practices that you can practice on your own. But if you want to have more in-depth practices, please again, I self-quote you for Brahm Center, sign up for basic or intermediate or advanced meditation class, or join them for the Happy Thursday. Okay, and of course, with these practices, we hope that you will lead to yourself being more aware of yourself, being more in touch with your own feeling, your thought, your bodily sensation, which is a very key element of mindfulness, and leading to, that is what important, dealing with everyday life. I don't think we just want people to learn to be mindful just for to prevent them from getting depressions or getting relapse of depression for those who are unfortunate enough to have suffered from recurrent depressions. But mindfulness has been shown to be very helpful in helping us dealing with our unhappiness or our day-to-day stresses or various situations in life. Okay, so we probably in this 2+ hour, I will talk a bit about mindfulness, what are some of the common misunderstandings about mindfulness, and share with you what applications of mindfulness has been, which are the areas that mindfulness have been used, what are some of the benefits and the evidence to show that they have been helpful. And I spent most of my time sharing a little bit more on MBCT, because that's the area where I'm training, and also help you to work out maybe how you can apply mindfulness in your daily activities. Okay, mindfulness, I think this is not something new. It's not only today that we heard of mindfulness. I think mindfulness as a practice, or meditation as a practice, has been around for thousands of years. Although it's primarily, people always say, attribute it to the Eastern religions such as Buddhism, Hinduism, Taoism, but actually it's been also, my understanding is also been practiced in some of the Western religious practices, like I also heard of centering prayers that has been used by the Catholic monastery. Okay. Sorry, I think I pressed wrong. Okay, all right. So as I say, this is in terms of the religious practice, both Eastern and Western spiritual contemplative traditions have been using these things. And even in psychoanalysis, Freud and all this, there's element of free association and free floating attentions. He actually has described certain phenomenon that is akin to mindfulness. Experiential therapy, such as Gestalt therapy and things like that, also has elements of mindfulness in them. But so therefore, it's very important to understand that when we talk about mindfulness, is something that is not a religion, okay? And it's also not only the hippies who does that. Or those, there are people who, the hippies also do something like that, but it's not a hippie stuff or thing. It's not related to drugs. It's not yoga. People say, does it mean that when I do mindfulness practices, I need to practice yoga? No, but yoga also incorporates, some teaching of yoga also incorporate mindfulness element. And mindfulness is not for relaxation. People say, is it for purpose of relaxation? Definitely not only for relaxation. Although there are people who practice mindfulness and say, oh, I feel more relaxed after I do my meditations and things like that. And definitely, mindfulness is not asking you to empty your mind. Because we always hear, when I do meditations, when I practice mindfulness, does it mean that I empty my mind? And when my mind is empty, why invite evil spirit to come into my mind? Correct or not? You do have this mission. It's not. And most importantly, mindfulness is therapy. Mindfulness-based therapy is now very scientific. Although it may have started off as a very contemplative practices in some religion, but the mindfulness I am talking today is not a religious practice, or it's not religious practice. It's very secular and it's scientifically proven. So when I talk about mindfulness therapy in medical practice or in clinical practices, we always must give tribute to this gentleman. He's none other than John Kabat-Zinn. All right. Although he is not the first one who practiced mindfulness, he's not the first clinician who practice this. He is probably the man who make it so popular in the clinical in the medical field now. John Kabat-Zinn is very interesting characters. I met him when I attended mindfulness conference last year in Chester. He's quite short, but when he was giving the talk, the conference was attended by about nearly 1,000 people in a small hotel in Chester. So beside the conference room, actually they opened up 2 other rooms where they video conferencing. And he actually can, when he give the talk and when he lead the mindfulness session, he was able to hold the attention of everybody. Very remarkable. He was a microbiologist, if I remember correctly, working in Massachusetts General Hospital. It's a very famous hospital in the state, one of the top-notch, in fact, world-renowned hospital. He started using mindfulness practices to help people in that hospital, I think 1979. Which group of people he helped? Basically, he go around sort of getting referral for a group of patients that no clinicians was able to offer anything. Basically, there are a group of people who presented with various types of chronic pain or medical conditions, which is pretty giving the patient a lot of suffering. And he started teaching meditations and using also, which eventually evolved into this thing called MBSR, Mindfulness-Based Stress Reduction Program. And he was able to help this group of patients to live and deal with their pain much better. And all of them, show significant improvement in the way they are managing their chronic conditions. And from there, actually it evolved into many other types of mindfulness-based therapies, including what I'm going to talk about, mindfulness-based cognitive therapy, which actually is a branch offshoot of MBSR. MBSR is an 8-weekly program. This whole program consists of 8 sessions on a weekly basis. Each session is about 2.5 hours. And MBCT also similarly 8 weekly sessions. And it's actually with added elements of some cognitive therapy and used mainly to treat people with psychological problems. Okay, so as subsequently, there's also other programs that come up, like for eating disorder, and dialectic behavioral therapy is more for those with borderline personality disorder, acceptance and commitment therapy, and so on and so forth. And of course, this is some of the well-established clinical application. In fact, in MBCT alone, in UK and US as well, the MBCT has been also modified to treat eating disorder, to help for parenting problems, for school program and things like that. So this is MBCT. Later I'll spend a lot more on talking about MBCT, and these are some of the cases. And in the non-medical area, I think it's also, if you have read Mind and Body 2 weeks ago, there was big article on mind and bodies. I think one of the feature article in Straits Times talk about all the various programs, mindfulness-based programs, including some mindfulness coaches who charge $1,000 for 10 sessions. Whereas you can get it almost free from Brahm Medical Center, Brahm Center. And of course, we have this Chek Meng, who is a Singaporean, a very colorful characters, I think very well known to NG also now, who actually started this Search Inside Yourself program, where he incorporates mindfulness and emotional intelligence to improve the creativities of the individual and to achieve happiness and success. And eventually, he said his wish is for world peace. Where else is mindfulness been at? And of course, just I mentioned, mindfulness in school project. And this guy is Chris Cullen. He actually was a teacher to start with, but he learned about MBCT. He was an MBCT teacher. Then he, with a few other colleagues, he actually developed a programs to teach mindfulness in school, which is known as a .B program. And he's initially based in Oxford Mindfulness Center. And he has moved on to do some other things. Chris has also a program in UK where he teaches parliamentarian, MP, member of parliaments, mindfulness practices. So this is what has been happening elsewhere, but in Singapore we don't have any. Maybe there's a job for NG to take on the Parliament House and teach them mindfulness. Okay, that's your challenge. Okay, and of course I say, if you Google on I just show some of this poster I managed to download from the internet, various programs of mindfulness. And also another interesting thing is mindfulness has just caught on also with politicians, not only in UK. US, there's one congressman, Tim Ryan, who wrote the book on mindful nations. And he's a firmer believer after he read about John Kabat-Zinn book and attended his meditation retreat. And he felt that if Americans can learn more about mindfulness, America will be a much better place. All right. So there's mindful nations. And of course, it's some of the things he's talking. And I think eventually it's world peace. If everyone is mindful and can practice mindfulness and talk meditations, the world we can eliminate violence from the world within one generation. That's quote unquote Dalai Lama. All right. So all this hype about mindfulness, where are we now? So what is mindfulness? Mindfulness doesn't mean your mind full of things. Or like this, aware of what is going on. Okay. Of course, mindfulness, there are many, many definitions, But usually it's a psychological, in terms of psychology, scientific, I don't think anyone has a perfect definitions, but it's vaguely translated into some sort of awareness or a bare attention, a very primitive type of awareness. There's even a term called meta-awareness, awareness of the awareness and what they are. And it's actually a way to pay attention to things, to events, to your sensations in a very sensitive, accepting, and type of a manner, independent of other thought. It's like something taking things in as they are. Very chim, right? I also find it very chim. But there are all these definitions. If you are doing PhD, you are writing research paper, you need to know. But actually, you don't have to know all this. One of the may not be a perfect definitions, but John Kabat-Zinn come out with this summary, which actually now have been well adapted or adopted by clinicians. We find it is a good working definitions. but of course I can share with you. I have read a book on Buddhist psychologists and attended some Buddhist psychology conference. They're arguing about the definition of mindfulness, and they say this is imperfect, but for, I think, our daily practices, this is very good. The element of mindfulness, meaning paying attention. This is the first word, is paying attention. In a very particular way. In what particular? It's on purpose. Actually, it's not a, you're mindful, so actually there is a purpose. But this purpose is so that your awareness is at this moment, and it's a very accepting type of way, and a non-judgmental manner. So, this is the currently accepted sort of working definitions for mindfulness, and it's by John Kabat-Zinn. Another way actually to look at it is with Chinese, if those of you who know Chinese word, mindfulness has been translated as 正念, or the right mindfulness, or just 练. Actually, Chinese word is actually very good. This Chinese characters consist of two parts. The top is a jing, the bottom is a xing. Jing, okay, means now or today. Actually, jing can also mean this, the here and now. And the xing is, of course, xing refers to heart, but Chinese, we always talk about the mind, our emotion, everything is, our thinking is using the heart, 用心在想。虽然我们没有说用脑在想，用心在想 but it's a paying attention. Your heart or mind is on at this moment. So that is a very good way of remembering what is mindfulness. Okay, and just now, one of the definitions is also talking about mindfulness have to be acceptance. The acceptance doesn't mean you just take things as it is, but acceptance is first you must be able to take it as it is, because otherwise you will not be able to move on. The tendency to, the opposite to accepting is to try to push it away or try to be very judgmental. Then it creates a lot of resistance for you to really deal with it. So therefore it's a very important element. And of course, this is one of my favorite quotes, is the importance of now, today. Okay, live today and not tomorrow or not yesterday. Okay. So, what are the benefits of mindfulness? I'm going to show you many slides to say how wonderful they are. This one is proven. I'm not going to quote you papers after paper, but actually proven to improve our stress reductions, improve your emotion regulations, improve your management of your negative emotions, improve your concentration. Even your immune system actually is supposed to have been enhanced if you do your regular mindfulness practitioners, and you are less likely to fall sick and you're more productive. So this will lead you to a happier and healthier person. Okay, and of course there are hard evidence actually to show that actually mindfulness make real changes in your brain. Before the, probably 3,000, 2,500 years ago, when Buddha or all the ancient saints do meditation, contemplative works, thinking, nobody can say they claim to be achieving various sort of state of calmness and understanding. Nobody is able to put something on their head and test. But nowadays, science can put on something on your head and test. Actually, there are real changes in the brain. In terms of EEG. EEG is electroencephalography or encephalogram. What it is basically pick up the electric signal sent out from the brain. And actually, there are some show real changes that with mindfulness practices. All right. I'm not a scientist, so but I'm not able to tell you what all this means. But that is what the book say, you know, or the researchers, the papers that I come across and say. Beside brain electrical changes, just not the activity we pick up. Isn't nothing very significant, right? Brain wave only, I just pick up some electrical impulses. Actually, the more the most recent one actually started to even, especially last 5 to 10 years, a lot more research papers come out to show that meditation have caused real changes in the brain. And good part of the changes, not those actually, there's associated with positive emotional stuff. Okay? Usually those areas that regulate our emotions. So this is no longer sort of something that's very wishy-washy. Okay. Of course, those of you who are interested, I can share some science paper for you. So actually, even for some brain changes, there are some papers to say that just a short practice of 6 weeks or 8 weeks of meditations, and for people who have no mindfulness practices previously, actually just a 6 to 8 weeks, half an hour daily practices can show real changes in the brain. So this is no longer just how I feel, I meditate, I feel good, but it's something that is going on in the brain. Okay, of course, we as a clinicians, what I will be interested is what can I use meditations or mindfulness therapies to help my patients. As a psychiatrist, actually, I'm quite happy to learn that, you know, there are many, many things that we can use mindfulness-based therapy to help our patients. While MBCT, my today's main topic is on MBCT, was sort of first developed to help patients. The main objective was to help people with depressions. And the first sort of strongest sort of evidence for MBCT is really to help people with depressions, and mainly for preventions of recurrent depressions for those who have more than 3 episodes of relapse. Okay, scientists are like that. You know? They are very exact in defining what it is. But beyond that, actually, you know, when MBCT was found to be so helpful, then they start using it to do research on other group of people. And actually, there are more and more evidence to say that they are also helpful for many other psychological conditions, such as anxiety, panic disorder, phobia, eating problems, some cases of personality disorder. As I already mentioned, like dialectic behavioral therapy is for borderline personality, and reducing suicidality and self-harm behavior. Even for that it be modified and used to treat people with substance abuse or addictions. You probably have heard of something called urge surfing or something like that. I have not learned that, I don't teach that, okay, but and reductions as in relapse rate for those who have been incarcerated previously. So, and of course, beyond that, you know, mindfulness has also been used for those who are doing corporate work, for leadership development, for personal developments, to help to improve yourself, and actually for medical populations, it's been shown to also reduce the rate of use of hospitalization. This is very interesting for the insurance company and of course our healthcare ministry. You know, if they know that mindfulness can actually help to reduce the dependence of hospitalizations, that will actually save us on the healthcare spending. Actually, as I say, mindfulness has been modified to use for school, and actually it does improve the performance and the behavior of children in school. All right, and And I know here in Singapore, I heard that our prison doesn't allow our counselor or to teach meditations in prison. But actually meditation or mindfulness program, this is a study from the state, have shown that actually teaching prison populations mindfulness actually reduce their aggressions while in a prison. And after they are released from prison, they also has less likelihood of getting into trouble. So it's something that actually our prison, our Home Affairs Minister may need to be enlightened. All right. Okay, so having said all this, good things about what are the different methods of developing mindfulness. Basically, this is just a quick introduction. Mindfulness can be achieved by formal practices or informal practices. Formal practices are those that require you to take time away and do it, and then on a standard basis. And informal practices actually to me are far more important because these are things that you can do throughout the day. Like formal practices will be like sitting meditation, movement, mindfulness, movement, mindful yoga, mindful walking or walking meditations, and things like that. And informal practices is actually something that we can achieve on a day-to-day basis. Basically, is apply this mindfulness in whatever you do, every day, even every minute, every now. Okay. So now, any questions? I hope have not bored you, huh? All right. Huh? Mindful cleanings. Yes, very good. We'll come to it later. All right, any other questions? Okay. Now I have gone through basically a general overview about mindfulness. Now they come to the meat of actually main thing is since you want to know something about mindfulness-based cognitive therapy. Okay. Actually, Mark Williams, just now the man I showed the picture, and William Kagan is the person whom I went to learn this from. Both are professor. I'm not. Because they are academic, I'm not. This is Mark Williams. He came to Singapore. I first knew him. In fact, although I myself, I must say that I have learned about meditations when I was a medical student. So this is 30 over years ago. That's a giveaway of my age. And I have been practicing meditation with break in between. Okay, I must confess. This is the common difficulty we'll discuss about in mindfulness practices. But although I practice mindfulness practices or meditation myself, when I come to the clinical applications of mindfulness-based therapy, I only got interested probably last 5 to 10 years. Or those, as a psychiatrist, I do sometimes advise patients, you can learn some relaxation technique, learn meditation, learn Tai Chi, some form of things to help them de-stress or cope better in life. But it's only when I start to read more about mindfulness-based therapy being applied in a psychological field or a psychiatric field that I get excited. And Mark Williams came to Singapore to teach MBCT a few years ago. I was fortunate that I was working in Alexandra Hospital at that time already, and we organized one course for him too. And that was my first formal training in MBCT. And that's because of that training, I got interested and went on to attend more classes and went on to attend mindfulness conference and went on to do my 6-week attachment in Exeter. He, just for your interest, he's not a Buddhist. He told me that he was, I don't know whether he still is, a Methodist or Anglican pastor. But he got interested in MBSR. He was a professor in psychology, clinical psychology. He attended some conference in Boston and got Massachusetts there, I think, got interested in MBSR, and after he read about the book of John Kabat-Zinn in 1999. And he and a few other persons, I think Zindel Segal, John Teasdale, who is from Cambridge. Zindel Segal, I think, is in Canada now. And three of them actually started to explore the possibility of using MBSR to help patients with depressions, because they felt that this is something that is very useful. And they incorporated the elements of cognitive behavioral therapy. They are clinical psychologists. In fact, in UK, clinical CBT, or cognitive behavioral therapy, is something invented in the UK or developed in UK, and it's quite a big thing even until today. And even until today, it's still very helpful. All right, I'm not saying that CBT is not helpful. CBT is still a very powerful therapy for anxiety and depression. But they developed this, they incorporated the element of CBT into MBSR and come out with 8-week programs to help patients with depressions. And the rest is history. And they actually want to develop it is to have alternative way of helping patients to stay out of recurrent depressions. Okay, because as NG shared, depressions cause a lot of suffering, not only to the patients, but the people surrounding them, their friends, their loved one, their family, even their bosses or their subordinates. You got a depressed, grouchy bosses, you are in hell. But if you are a boss, you have your staff will have depression. You also have a lot of problems because your department cannot move. All right. So therefore, it's a lot of suffering. So, but mainstay of the treatments. I'm a psychiatrist. I prescribe medicines. So they are one. It's of course maintenance antidepressant. I must say, as a psychiatrist, I must say, antidepressant is still very important in treating acute depressions. But to help patients stay, once they got better, to prevent, we always treat patients, this is not a talk on the depressions, but quickly just to share with you, when someone suffers from clinical depressions, not I'm depressed, I have depression, but it's what we call clinical depressions, I mean the sustained period of low mood associated with many other symptoms, then we say this person has depressions. The treatments for acute depressions is antidepressants is very important. But after the person says get out of depressions, we always consolidate the treatment for a few more months. That means even I feel better already, the psychiatrist will say you stay on for this medicine for a few months, then we're tapering off. But for patients, unfortunately, depression can be recurrent. There are a group of people who are unfortunate and when they stop the medications, the depression come back. And for this group of patients, one of the options is to take long-term antidepressant for life. So we want to find out, or they want to find out, besides antidepressants for life, are there any other way? So that's why they've actually looked for various different psychosocial approaches to help prevent recurrent depression. And why psychological method may work. That is because of the understanding from the cognitive behavioral model about how we think. Especially people, even normal people can also have this thinking called autopilot thought. Have you heard of autopilot thought? Nothing, this is got nothing to do with MH370, this is a disclaimer. Although I feel sad for them, but this is a disclaimer. Autopilot. Autopilot thought. Have you had this experience? You go to, you're watching a TV or programs or watching movie and have a box of popcorn in front of you, and you're eating, you start eating, or a box of chips. Before you realize it, it's empty. Correct? That's why I put on weight. That's another part of healthy living, weight management. But anyway, this shows that a lot of our behavior is in autopilot. Another example, those who drive. You, the morning you wake up, you get into your car, you put on the key, the next minute you realize you're at your work office. Correct or not? You don't know what happened in between. Dangerous, right? Autopilot, or those in certain situations, for example, crisis, emergency or something where you have to just use a drill to, sometimes we have like fire drills so that we want people to behave autopilot, hear the fire alarm, you quickly must get out, drop everything, get out, run to the nearest fire or safety or get whatever point. But for day to day, actually sometimes it can be dangerous. And it's particularly unhealthy for people who have depressions. Okay, so this is what wordy. So I just give example, you understand what is autopilot, right? Cognitive behavioral understanding is understanding of our thinking based on this model actually helped us to say why we can use CBT, incorporated mindfulness, to help. All of us have thought, thinking. And this thinking always, when we think of something bad, something negative, it will always bring on to the mood or the feeling, all right? So think of something bad happened to you, then you start feeling lousy. Or think of somebody who owe you money, then you start thinking of angry, all right? And then when you feel moody or you feel depressed, then you always have something that is called your physical reaction, actual bodily sensation. All right, you're angry already, you're moody, sometimes you feel that your chest like compressed, you feel that your shoulder drop, right? Or you feel angry, you feel that your heart beat very fast, And sometimes it leads on to certain behavior, or you impulse, you want to do something about it. They say someone you think of someone who make you angry, did something bad to you, you get angry, and then you say, I must call him and scold him, or call her and scold. So this is understanding that this is called cognitive behavioral model about our behavior. And quite often also, for people who are suffering from depressions, they tend to have this autopilot thinking that when they have something trigger, something happen, they tend to start thinking of negative things. And this because of very automatic thinking negative, like just for example, someone with history of depressions, and now something bad happened, may not be something very serious as just being late for work. Then they say, oh, I'm no good, I cannot get to my place on time, I'm not a good worker. And then you start getting the negative emotions, start feeling low, start feeling all this, feeling sick in the body, and they don't want to move, don't want to get out, because they see that they are no use, they're useless. And then they escalate. So these are called the negative thinking cycle that sometimes is seek to actually affirm what we already set out to think. We think that we are no good, and then all this negative feeling, negative sensation that arises confirm that we are no good. So actually become a vicious cycle. It feeds on itself. All right. What we want is actually to get out of this mode of doing or automatic pilot, what we call doing driven mode, to something that we want to start becoming more aware. That is where the mindfulness mode coming, the being mode. You always hear of this doing being, but want to help me out? All right. And in our doing modes, everything in automatic pilot or autopilot mode, I think just come very habitual, based on our past. And when we, instead of seeing things or sensing things as they are, we tend to be very analyzing, analytical, and passing judgment on ourselves instead of being very accepting of what thoughts they are. And quite often, this is a common error, is people see thoughts as real. Instead of thought arises just as mental event. When you think of, just like I think that I'm no good, you think that this is real, that it's not good, but you don't realize this is just your thought arising for something triggering you. So in the doing mode, if you continue for a negative situation, it becomes draining and demanding, and you drift and daydream. What I mean is, because you are not living at this moment, and you tend to think of the past, or you worried about the future instead of what you are able to live now. You tend to drifting in and out and daydream. And also because of this very preoccupied things, you tend to you try to avoid unpleasant things because you are afraid to get hurt or get pain again. Instead of, sometimes important is to go and approach it with interest and to find out actually more. So one of the key elements of mindfulness is actually trying to change the relationship between you and all this emotion, this thought, this sensation that you can arise in you. It's hard to explain, but I know when I say something, I also find it hard for me to understand. But the important thing is, basically, practicing mindfulness is to help you, if you do it, to be more in touch with yourself, with your own way of thinking, with how your body can feel, how your mood can feel. And that change the relationship between you and what is happening in you. Do more and you will realize it. Yeah, and when MBCT first designed to treat depression, that is basically of what I say is the cycle of escalation. Sometimes, for people with history of depression, even a slight change in mood, especially going and sliding down, can actually start to bring back bad thought about what happened in the past. And this negative thought itself will feed on to this change in mood and leading on to start feeling unwell and all that, and escalate the whole thing. And what MBCT trying to do is to break this cycle. But this is just a cartoon. I suck. Life always sucks. So you break this cycle. Okay, so therefore, why MBCT is useful is because it combines the mindfulness approaches with the CBT. In the past, before MBCT was designed, MBCT came out, CBT is one of the mainstay of psychological intervention for people with depression and anxiety. But any of you heard of CBT? Some of you may have, helping professions or do counseling work or do some psychology. CBT tends to be, although it's a very good model, a theoretical basis to understanding our emotion and our thought, but the technique used in CBT or this cognitive behavioral therapy is a bit more, they tend to want you to challenge yourself and force changes in your own thinking. It's a very rational way of doing things. Again, it's got to do with doing more. Instead of helping you to be more accepting and slowly effect the change, CBT tends to be more directed and change-driven. But it itself is useful because it does help. The component you incorporate with CBT and mindfulness, this understanding of this, why we get depressed, why we have recurrent depression, and why we feel suicidal sometimes is helpful. And it's formed the basis of creating certain psychoeducations for the patients. And also CBT does give them the way to understand that there are options for you to skillfully deal with your emotions, skillfully deal with what you can choose to do, all right? Such as doing nourishing activities, option for working with negative thoughts. When negative come, what you can do. And therefore help in you to do all this relapse prevention and action planning. But we incorporate in this mindfulness technique in the MBCT and the approach, which is a lot more gentle and emphasize of the person getting control of themselves and using the mindfulness practices to help them to understand that their mind is actually operating in autopilot mode and shifting them from this autopilot mode to a very being the present moment type of mode. Create this awareness, all right? And because of this, creating this awareness, they are more in touch when their negative emotions or their negative thought arises. This is the gist to me of what is this mindfulness practice can do. And also shifting, as I say, automatic and the doing mode in the and also shifting them from a very intellectual construct. That's why I say CBT, the old way of doing it is very rational, very intellectual. It's nothing wrong with that. But intellectual change is good for rational things. Engineer love it, and engineer very system-based. When A happen, press B. When C happen, press D. When D happen, don't know what to do. But we are human beings. Our emotions are more intricate. So therefore, a mindfulness practice bring more direct experiential approach. Help them to have this, create this awareness and able to adopt this more accepting way of dealing with your emotions, help you to handle it better. So therefore, this and that combined work wonderful. And also shifting them, help them to shift from a very critical mindset, I'm no good at others. Because one of the things I teach you is, I mentioned is, throughout the mindfulness practice is adopting a very non-judgmental and compassionate approach to yourself. And also moving from a very avoidant type of behavior to that of a more approaching type of a behavior. Approaching, because you will see later that mindfulness practices help you to see that mental events happen, can be a pleasant, can be an unpleasant situation, but you can just learn how to approach them with this curiosity, with this kindness to yourself, and slowly able to deal with it. All right. So, therefore, in that paper, there's in the editorial done by Mark Williams, he actually tried to understand, he felt that MBCT work because of two elements. Beside mindfulness, the other thing is compassion. In fact, this is the latest things. There will be another talk about. The latest research focus is to look at the evidence of the importance of compassion, of self-kindness in contributing to how MBCT works. So actually there's a lot more research, but it's a separate issue. But they also noticed that because the review of a previous result showed that people who are able to be self-compassionate at times of low mood can break the link of the reactivity, the cycle of this, just like I say, easier. Okay. Breaking the change, all right. As I say, you don't force them to try to change the content, but it's the way they deal with it, the relationship, okay? And you achieve it by repeated practices of observing, noticing, and shifting perspective in your mindfulness practice. Therefore, mindfulness practices work only if there's commitment to do it every day. For treatments of depressions, or regularly, I don't say every day, okay? And helping them to discover that, key element is all these things thought that come into their mind are not real things that they are. They see it as a reality, but help them to realize thoughts or emotion arises when something hits you are just also mental events. They come and they go, all right? So this is the key things in mindfulness. So therefore, is to let go instead of fighting. And in order to break this change, this is something for you to enjoy. Some cartoon, people who are unable to let go in their therapy, the arm get longer. Maybe it's a chimpanzee in last life. Anyway, if you cannot let go, when you learn swimming, you'll never reach the other end of the pool. This is a very good analogy, letting go. Okay. All right, so what is MBCT? Okay, why I talk so slow? I try to fill up 2 hours. No, okay, so that you can absorb better. Any question? No, MBCT, okay, now it's a technical part. All right, MBCT, actually, if I do a full MBCT with you, you have to come to attend weekly sessions 8 times. And it's 8 weekly sessions. Each session is 2 hours. And actually, it's a graduated programs. Because of that, I can't teach you in one session everything you learn. But it's to slowly create all these things, awareness about what I teach you in the last, what I mentioned in the last 1 hour plus. But during the 8 sessions, we try to gradually bring them understand, create this awareness, especially lesson 1, first 2 hours, we do some exercise, help them to create this awareness about this autopilot thought, and then teach them some simple technique, go back, do homework, and then come back. And second lesson is to help them living in the theme is called living in our head, to see, a lot of time we actually live in our head, imagine a lot of things in our head, and then slowly after they realize, have created that awareness is very important. If you don't have the foundation, you cannot go on to other lessons, because be mindful and remember that MBCT actually initially designed to help people with depression. So slowly, once they realize that, we start to help them to gather their scattered thought, scattered mind, and next lesson, realizing what are the aversions. And after they realize that, then learning to allowing themselves to be and letting go. And only that, the 6 session to start building on these things about thoughts are not facts, And subsequently 7 and 8 sessions to consolidate what they have learned and teaching them to how to best take care of themselves and moving on in future, maintaining and extending like that must be last minute typing. Okay, and sometimes certain center will incorporate certain one day retreat in the program, but usually the minimum is the first 8 lessons. So, are there in Singapore anyone do this program? My understanding is none in the public hospital. I have started running this program for my staff only. And the first public groups, can I do a little publicity for myself? I'll be running the first MBCT group for public starting in June. So those who are interested, watch out for advertisement. But what are the core themes in MBCT? It's basically, it focuses on how best to prevent establishment of negative thinking patterns and help them to see 7 signs of this driven doing mode. actually a lot of repetition. It keep coming back in the different lessons. But the key of it is throughout the whole sessions, a lot more. It's not like me talking, every week is asked you to come here, listen to me for 2 weeks. I think 1 week good enough already. But the whole 8 weeks, very little on theory, mainly experiential. Come in only, we give you exercise to do, okay? And the key components of MBCT is inquiry. Inquiry, some people call it review, some call it sharing. It's very much about every participant talking about how their experience, how they have gone through. Even, for example, I do a sessions, I give you a sitting meditation. After that, we straight away launch into an inquiry. Everybody will talk about how they feel, how their mind wander, or whatever not. And that is very important element. And it's not to find out whether you're doing it correct or wrong. There's no right or wrong experience. Good thing about the whole MBCT treatment is very gentle, very giving. It's just take things as it is and helping you to come to yourself, be aware of yourself. So the kindness and empowerment are very important. Throughout the whole therapy sessions, although it's a therapy sessions, that we don't call ourselves therapists because we are just instructor. We give you instruction and teach you how to do it. Who are the therapists? You are the therapists. You are the one who make yourself better because you are the therapist. So although it's a MBCT, the T is therapy, but we are not the therapists. We don't make you better. We tell you what you can do, but you have to walk the road. Just like if you want to go to Woodland, I can tell you which bus to take, how to go there by MRT, or you can go by taxi. But you have to do it. If by sitting here, you'll never get to Woodland. Correct or not? Same thing. So basically, in the process after the 8 weeks, we hope that we will improve their concentrations, create this awareness of their thought, emotions, and their bodily sensation and their impulse to act. And being in the moment, able to decentering is another concept. The other I talk about, what is decentering? Is that when some thought come to you, or emotion arises, you're able to take a step back and watch that this is not yourself. This is just a phenomenon, mental phenomenon that arises. This decenter. And acceptance, letting go, all these are things that we hope the participants of MBCT will acquire if they do their home practices. So, actually, this is how it looked like, one of the sessions. I was fortunate when I was in UK, I visited Bristol University. Actually, they teach this to medical students. MBCT, although, as I say, been in the clinical setting, in the psychology or the psychiatric department, we use it as a treatment mode. But MBCT is gaining popularity, and a lot of people are learning it, not just only for depressions, but for their day-to-day living. Okay. So these are some of the exercises we do in the MBCT. Raisin exercise is to actually, I don't know whether I should break this. Actually, you probably may have heard of it. It's actually to give you a small raisin to help you to appreciate that just eating a raisin. Have you eaten raisin before? I explain, because it's 200 of you, I can't afford to give 200 raisins. No. Actually, it's a simple exercise. One day you can go home, or today you go home. You just take out one piece, if you eat raisin or eat some sweet, instead of just popping it into the mouth, a simple thing is we ask the participants, imagine, not imagine, all of you holding a raisin in your hand. this is the first time you've seen this raisin. How does it look to you? How does it feel to you? And then you bring it to your nose to smell. What does it smell like? And then we sometimes do a very weird thing. Shake it and you can't hear anything. And then only after go through some of this, you put it to your tip of your lips, then see how you feel like before you go to the mouth, and notice what happened at the back of your throat. And then before that, then you are allowed to take the first bite, then what happened? And then you follow it, then start slowly chewing it. And then before you swallow, and see whether you can follow it. This is a very simple exercise to create, as I say, first lessons is automatic pilot. Okay? Automatic pilot is the what we want to help people to create this awareness. Although we keep here talking about it, but until you do it, you don't realize how much different it is. I've done raisin exercise Humpty times, either as a participant or as an instructor myself. But every time, even that is to me is a new experience. Okay, all right. Then we also do body scan. We don't do in MBCT, we don't straight away teach meditation. We do raisin exercise, create awareness, then we do body scan. And then we teach them to choose some daily activities to be more mindful, and then give them home practices. This is an example of what happened in the first lesson. Okay. Yeah. Basically, it's for the mindful eating. If it's a squirrel come to my MBCT, I'll give them a nut. You come to my session, I give you a raisin. But just share with you, very interesting. When I run this with my staff, then one day I say, every time I give raisin, no problem. Who have not eaten raisin here before? But I saw one of my, we hold the name, I don't even say which department he came from, in case some of you are from Khoo Teck Puat Hospital, then you find out who he or she is. He was just holding the raisin in his hand and even refused to put it in his mouth. Then, of course, at the end of, we don't force people to do things. One good thing about MBCT is your instructor are very gentle one. Never force you to do things that you don't want to do. And I asked him, at the end, when we do the inquiry, then everybody share. Then I say, okay, what happened to you? I don't put strange things into my mouth. Yes, instruction I gave is treat it as if you see it for the first time, but it's a raisin. They told me, Dr. Ong, I've never eaten a raisin before. So, lesson I learned, there are also people who don't eat raisin. Although we make assumption, it's my automatic thinking, right? Everybody eat raisin, so we don't ask questions. Just give this is a small object, you just assume it's it. But it's very, very interesting. We do have that outcome. We make assumption about a lot of things. Okay, I don't want to digress. Sometimes, okay. So I'm not doing racing exercise with you. The monkey. We belong to this species, so we don't belong to this species. But one of the closest relative of human being. Body scan. What is body scan? As I say, that we are quite often quite in touch with our thinking, but how often we are very in touch with our body sensation, all this, we don't. So one of the key exercises, body scan exercise, in the session is 30 to 40 minutes, is to help the participants to create this awareness of your body sensations. Shall we try it? I'm not going to do 30, 40 minutes. I'm going to give you a shorter version because you don't pay me. Joking. Because this is just a seminar. This is trying out. Okay. All right. Usually we do body scan lying down because that's the best way where you can actually feel yourself better. But for the sake of today's practice, we do it sitting. Of course, we do allow people to do the sitting. So the first thing is if you are lying down, if you do it at home, is to find a place where it's fairly comfortable. and you don't mind lying on the floor. If you have good carpets, you don't need to put any mattress. But if you want to do it on the bed, can, but don't fall asleep. And what you do is make yourself comfortable. If you're lying on the floor, if you feel that your neck is not comfortable, you can put a pillow. It's okay. There's no right or wrong. But sitting, okay, you can just find a comfortable posture and get next 30 seconds, settle down. In order not to drift off, I usually advise you not to lean against the back. So you may just keep yourself upright and your back slightly, you can lightly touch the back of the seat, but don't lean back and because you'll fall asleep. Okay, once you're settled, you can invite you to close your eyes. Okay, if you're not comfortable closing your eyes, you can keep it slightly open, gazing maybe on the floor just before you. But this exercise is best done with your eyes closed. Okay. When you're settled, I would like to invite you to bring your attention to your abdomen. Feelings, any sensations at your abdomen. You can try to follow it. You follow your breath as you breathe in through your nose, down the chest. Follow the breath all the way to the abdomen. And watching how you body feel there. Whether there is any warm, any tingling feelings. Just notice how it feels like and register it. If you don't feel anything, it's okay. Notice whether there's any change in the sensations. As you take your next breath out and breathe in, I'd like you to move your attentions away from the abdomen. Follow the breath down your throat, to the chest, to the abdomen, all the way to your right leg, down to your right toes. Noticing the sensations of your toe touching the ground. How does it feel like? Noticing any pressure or any tensions, or any itch that you feel like wriggling your toe. Expanding your awareness to that of the sole, the heel, taking in the feelings of your foot as a whole. At any time, you may feel that your mind wanders away. It's okay. Take note of where your mind has gone to and what is your thought. And gently bring your awareness back to your foot. As you move to your foot, at the next breath out, shift your awareness away from the foot and bring it to your right knee. Feel how it lights, how your knee feel like, touching your clothing or that of the air. Feel your bone and the muscle around your knee. As the next breath out, shift your attention away from the knee and follow your breath through the chest to the abdomen, down the left leg and the left toes. Repeat the same thing, examining how is your sensations of your left toes, that of all 5 toes, and the toes touching each other. At any time, if your mind wanders, just notice where it has gone to and gently, kindly bring it back. As the next breath out, breathe the attention back to abdomen, watching the sensations of your abdominal wall rising and falling. If there's any strong sensation that arises, you may just want to, with curiosity, breathe into these sensations and see whether, and noticing any changes of the sensations or no change at all. Just taking note of what they are. As the next breath, I would like to invite you to expand your awareness to that of your whole abdomen, your chest, your neck, your head, your upper limbs and lower limbs, and create the full awareness of your body. Anytime if you feel like dozing off and need with the urge to want to open your eyes, so it's okay. Just feel how your body feel like, the various parts. And it's the next breath. I would like you to get ready to open your eyes. I give you a snap of my fingers. When you hear that, you may open your eyes, and you feel like stretching your arm after you open the eyes, or rub your body parts or anything to make yourself feel comfortable, do so. Sorry, I forget to bring my meditation bell is in the back, so I use a finger snap. Thank you. This is a very shortcut version. It's only, did I put it? Oh, where is, anyone have taken my bell? Oh, I'm so unmindful because I didn't sit there, so it's my, anyway, this is called, we usually use this bell, although it's used in a lot of Buddhist ritual, but it doesn't signify anything. It doesn't invoke any bodhisattva or Buddha, but it's just very soothing. And we usually use it to signify a beginning or the end of any practices. Okay? All right, for those of you who want to, actually there's some apps that allow you to set timing and they give off a similar sound. So now you don't even, you can save. This one cost me 20 pounds, 18 pounds or something, not cheap. Anyway, so anyone, okay, typically after a practice like that, we'll do inquiry, is to ask the participant how they feel, you know, and would you like to have anyone want to share or just say how you feel and anything? Of course, the whole exercise of a body scan is 35, 40 minutes. It actually will go to a lot more. We actually start from the toe. We can start from the toe up to the head, or from the head down to the toe, and actually we examine the sensation in different part of the body. But for today demonstration practices, actually I only pick and choose a few places. And okay, anyone volunteers? Or all of you fell asleep? Nobody want to share? Okay, it's okay. Anyway, in the whole MBCT, throughout the sessions, as I say, important element is this called inquiry. Of course, it's a group of 200. I don't think anyone have ever attempts to do an MBCT lesson in for 200 people. But typically, we do inquiry. Inquiry is a powerful time for learning. And there's no right or wrong answer. And it's helped the participants to see that their experience is unique, and advise them to be gently and with curiosity to explore all this feeling. And of course, as it goes, subsequently, when they do a little bit more and dealing with their negative thought and all this, there will be maybe sometimes certain suggestions on how they may want to deal with it when things happen again next time. But for the first few sessions, it's a bit like getting to know various techniques of things. So it's not so much of this sort of directive thing. Okay, so you don't want to do that. Okay, next is, at the end of the first session, we also start to create this awareness in mindfulness in daily activity. That's what they pay me to do when I'm in UK, you know. I have a lot of cream teas, but I still remain okay lah. I didn't put on so much. Actually, I lost weight. Surprisingly, in UK, I spent 6 weeks plus 2 weeks holiday on my own. 2 weeks holiday, I pay myself. Otherwise, you go and tell my tauke that I jiazhua. Yeah, I enjoy the cream tea. And actually explore all the good places with cream tea. I have this, any one of you know of good cream tea, good places who sell good cream teas in Singapore, let me know. Very expensive in Singapore. Anyway, one of the things we do want to eventually build up in the MBCT is for these generalizations of this mindfulness in daily activities. From session 1, we already start asking the participants to think of some daily activities that they can have mindfulness. So, for example, washing is a common thing. Yeah. If I have given you the example of how to be mindful and raisin, the same thing in mindfulness in washing or cleaning or brushing teeth. All right. And it doesn't mean that you have to deliberately slow down, but you are probably more gentle, and you'll be more focused. You put your mind into what you are doing, and observing what actually going in your mind, how you feel. You know, just for example, every morning when you wake up, first thing is you jump out of the bed, you go to the toilet, you ease yourself, you take out toothbrush, you brush teeth, everything is very automatic, and then change. In the next minute, you're in the car or you're on the MRT station. But if you choose to be more mindful, in fact, first thing I wake up, I tell you what I do a body scan myself. Although a lot of people, I don't do 30 minutes. Having practicing for so long, if every day I have to do 30 minutes body scan, 30 minutes sitting meditations, 30 minutes, 30 times of 3 minutes breathing space, I probably don't have to work. But deliberately, I would do that. You know, through my experience, I've sort of bridged it into 5-10 minutes practice, and I do really scan my body. And then before I get out of bed, that is the best time. Even before I go to sleep, I also do another body scan. Okay, and you can just brushing teeth, for example. Instead of just automatically take out the toothbrush and toothpaste, do it. Try to create some awareness of how you do it and how the toothpaste look like. and very look different. Before you put it to your mouth, how does it feel like? You smell? Do you smell the toothpaste? You don't, right? Okay. And how does it feel like when the toothpaste touches your teeth? And how is your first brush feel like? Do that. It will give you a 全新的感觉, a brand new feelings. Okay, I'm giving advertisement. I'm not advertising for Colgate or Ducky or whatever. Dudley. No, cannot be. It's used to call it Ducky, now it's called Dudley because it's been racist. Okay, so this is give you a flavor of how you feel like. Second lesson, then we again, very little talking, we launch into another body scan, do the inquiry. And sometimes we'll give some mental exercise or some situations to get the participants discuss. One of the common things is, for example, waving to friends. We give them to an imaginary situation, how they think. And then second session, we start teaching. Then we start teaching the mindful sitting or the meditations. And we do a present event calendar and give more home practices. This is a flavor of how it looks like. What is waving to friends? Okay, now we do this exercise. Okay, all right. Imagine. Now if you want to imagine this, close your eyes or imagine it with your eye open. You can. Imagine you are a bear. Your friend is a panda bear. Panda not bear. Walking across, you are walking down the street, Orchard Road. And you are actually a good friend of Panda. You are walking down, it's so Panda coming to Singapore, you're so happy. You're waving very hard, in the very crowded place called Orchard Road. But Panda look like oblivious to your waving, just walk across, walk away without even responding. So we give this exercise. So what actually we are asked, what is your thought? What if you're walking down the street and you're waving very hard to your best friend, and he doesn't? How is your response? So we do this exercise, and when you have this thought, what emotions or what feeling come to you, and how you feel, how your body. Do you notice any change in your body, any sensation? Anyone want to volunteer?
I feel disappointed.
You feel disappointed. So you're feeling, your thought is you are disappointed. And your feeling? Upset or anything?
Not upset, but not noticed.
You feel unnoticed. So your thought is you are disappointed and you feel unnoticed. You notice anything you feel when you feel that you are disappointed, and usually how?
Maybe I'll try it another time.
You'll try another time. Okay. Any other response?
Feeling transparent.
You feel like what?
Feeling like as though I'm transparent.
You're feeling like transparent. 透明的，当我透明的哪里可以？假玻璃哈。Okay, and then when you feel that why he treat me as a, usually how would you feel? You notice if you have some thought come to you like that. Usually
Yeah, like
okay.
nobody.
You're nobody. Okay.
Not human.
Not human. Do you feel like when you feel like that? Do you feel you're empty? You feel like you something quite sad. So your feeling is sad. Your thought is, I'm transparent. Then I feel sad. When you feel sad, usually you feel what? Your heart, chest tight or something.
Just sad.
Just sad. Okay. Any other different response? See me no, call what wiki Then so your thought is see me no. Then what else?
Angry.
Angry. When you're angry, how your body feel? 仙 Okay, 仙 means you feel tired, you feel like let down. Okay, any other response?
Perhaps that friend is sick.
Sick, okay. You start thinking that maybe he's sick. And then if you think that your friend is sick, you're feeling concerned. You feel concerned, you still feel worried for him. Yeah. And then you have your body usually how you feel?
Perhaps approach her.
Approach. You want to approach. Okay, you have impulse to act. I heard something else. Yeah.
Maybe he cannot recognize.
Yeah, maybe they could not recognize you. Then
I'll call him one day.
you call him to clarify.
Yeah.
Okay. All right. So you see, why we do this exercise? It's a very simple exercise. It's to show you that actually just a single situations, it can trigger different response in different person. All right, that's number one. And number two, and you also get the participant realize when you have certain thought lead on to certain emotion, and this emotion usually have certain bodily feeling, the feelings in the body, a sensation in the body. Okay, there's no right or wrong. Of course, typically there are people who feel like, wow, he think that he purposely ignore me, therefore like see me transparent, see me no up, and then I will start getting upset, Okay, and then when I'm upset, I can feel, my heart very heavy or something like that, Then on the other hand, there are people who say, I feel that, maybe he has something on, he's preoccupied, and then I start having this feeling that concern, worried, And then you also, when you're concerned, worried, sometimes you also feel something arises in the body, all right? Or sometimes you try to rationalize, they say, he might not have noticed me, he's probably calling girlfriend or something like that, not noticing me. So therefore but sometimes because he noticed me, but I wave like that, like mad dog in mad bear, I feel embarrassed. There are people who say they're embarrassed, So it can be really, and when I'm embarrassed, I feel my hot flush, my ear red, So all these are exercise to get the participants to be aware, So these are things that we do in the MBCT exercise. So that's why, even our section 2, still only at this. And of course, we also get, one of the things is to do a pleasant events calendar, getting them to, start noticing, this is a homework. We should give them homework to get them to start noticing good things that can happen to them, pleasant things that happen to them, and have to document it every day. With a pleasant event, like people at the end of the shift, you finish, you hear birds singing, this is an example they give, then you feel very light-hearted, happy, you feel your body very light, the thought going through in you. And we also notice, you notice, like we say, what thought went through your mind at that point of time, and what thought are in your mind now as you go in. So we want to also make all this have reason where the questions are being asked, is so that actually they can have a learning experience, is that sometimes certain thought that even past event can bring up certain type of emotion, even if it's just a memory. Okay. All right. So these are things. And we start also teaching short sitting at session 2. All of you have done sitting meditation here before? Want to try do one here? Okay. But basically, because be mindful that MBCT, many of them actually come to this, become aware of this MBCT or mindfulness practices for the first time. So the whole approach is very graduated. And even the first sitting is usually about 10 minutes, all right? And of course, again, for sitting meditations, we will do it either sitting on the cushions or sitting on a chair, all right? Here, of course, shall we just do a sitting on a chair? So this is the first taste for, actually this is for many of the participants, this is actually the first taste of their meditation practices. And so we usually do not make it easy, difficult, and so basically the advice is how you sit, whether your eyes can be open or closed. Some patients or some people are not comfortable keeping their eye closed, so we give them suggestion that they gaze their eyes a few feet in front of them. You can do that also. Or sitting, you can sit on a cushion or you can sit on a chair if you choose to. And even using the breath why we choose breathing as a focus is this is easier. You breathe, all of us breathe. So our breath is a good place to be an object for the meditations. And whether do you breathe far harder, deeper? No, you just breathe normally. So this is again another piece of advice when you do this sitting meditation. And where do you focus it on? Tip of the nose is common for many meditation, but there are some people who find it very difficult. Where my nose not very pointed, I don't have a sharp nose like Angie. So some people say we suggest they use the abdomen as a place where they watch the breath. No, put a hand there, put a palm on top of the abdomen and watch it. Get a sense of it. So there are many different techniques, and after that is to inquiry again. Do you want to share how anyone of you meditate or sitting meditation for the first time? Anyone? How does it feel like? I see someone nodding head, but okay, all right. Anyway, we are already towards there. Okay, so if you don't want to share, it's all right. Then and other exercise that we do is mindful movement, all right, which sometimes can be in the form of stretching, can be form of yoga. We never attempt this because I can't teach that. But sometimes simple yoga stretches are used. Depend on the instructor. Some instructors are very good yoga practitioners themselves. They choose to teach yoga. If those of us who are not well versed in yoga, then we do some stretching for movement. Again, is to create this awareness for the participant. And mindful walking. Certainly, this is the negative demonstration of mindful walking. All right, we do practice mindful walking, but of course today I'm just telling you what is happening, and also remembering that we are using MBCT to help people overcome their depression. So subsequent exercise will start when they get into the hang of some mindfulness practices, then we introduce this element of helping them to start watching their automatic thoughts. So we'll do some exercise on negative thought, and then we'll move on to do early recognitions of early sign of depressions and how to do relapse preventions, working with their negative emotion, unhappiness, or if they have certain avoidance, there's aversions. We also start working them in the mindful way. We start introducing some of these elements in their meditations and getting them to work on it. And also then we have some exercise of what are some of the things you can do to be kind yourself, to be kind of self, being kind to yourself and do some of this stuff that yourself. Okay, and eventually, at the beginning of my talk, I said the purpose of MBCT is not only that 8 weeks of the home practices, it's to create this mindfulness in every day. That's why you see, I purposely choose the picture, Mosque Street, holy place, have nightclub, but a very good juxtaposition there. Anyway, but it's to really practice mindfulness in your daily practices. So, as I say, I like to quote this Lama Yeshe that said, meditation does not imply only development of single-pointed concentration, sitting in some corner doing nothing. All right, this is a good, important. I'm not saying that meditation is rubbish. I meditate myself, but meditation doesn't mean you just sit there and do the sitting meditation. That is a formal practices to cultivate your ability to achieve that awareness. But meditation is actually eventually you want to be more, have an alert state of mind instead in the opposite of being sluggish, and also have wisdom in doing your things. And you should remain aware every moment in your life, fully conscious. That is the purpose, So, therefore, this 10-pointer actually I downloaded somebody actually quite good, quite hardworking. There's this one is not my credit. This one I copy from internet. How to turn off autopilot and live your life to the fullest. Some advices, I think good thing is you start creating this awareness. I think be thankful, appreciate of what you have, appreciate for what other people do things for you. Small act. Even your wife give you a glass of water, say thank you, I think, A lot of time we don't do, right? 老婆给我倒杯水. Confess, I sometimes do that. Now I start to say thank you. All right. Start listening with your mind, with your heart, And the other thing is also do more, sit with your body, quiet your mind whenever you have opportunities. Be more aware. Simple things like being more aware of posture. You start like, when I slouch, or do I just become sluggish? And think of those who are less fortunate is also a form of not getting yourself being more compassionate. Practice relaxation. Eat slowly. When you eat, when I started teaching mindfulness to my staff, one of the things is daily activities. After ask the staff to go and one of the exercises, go and choose one daily activities that you want to do. Some of them choose to say eating their meal. And after 1 week they come back, Gee, Dr. Ong, I never realized that the rice tastes so nice. How often, do you still remember how your Thai guo an pei la, or whatever, Wang Zhu an pei la rice is so expensive taste? You spend so much money buying good rice, but do you actually go and do what I say, like the raisin exercise? Taste it. Yeah. Of course, driving under the speed limit, we tend to autopilot when you press. But when you drive you are driving more mindfully because you are more watchful. Okay, it's also safety. And I think the other thing is our curse in life is everything iPhone, hi. But quite often we recognizing answering your cell phone is a choice, or recognizing that taking every picture before you eat, every meal you eat is also a choice. No, I think this guy is quite funny. Okay, and do some things to make yourself feel good. Now there's a lot of this positive psychology thing, talking about flow and all this. Yeah, actually one of the things I enjoy doing is calligraphy. And the other things I enjoy doing is gardening. I grow some water lilies and lotus. And actually these are things that make me feel good. And when I do these activities myself, and time just passes without me notice. Sometimes I start writing my calligraphy at 9 o'clock, but before I know it, notice it's on midnight. Time just like, tick. So actually, these are things that you can start cultivating and doing it. All right. And of course, meditation is, I like this quote, meditation is the ultimate mobile device. You can use it anywhere, anytime, obviously. You don't even need an iPhone for that. Okay? But yeah, of course, nowadays apps got a lot of guided meditation, guided eating, give you the free meditation bell ringtone. But actually, you don't even need you can meditate everywhere. It's the best. You don't need to spend $998 to get an iPhone 5 or something like that. Okay. All right. So these are the hope you can go back and take home all these things. Before we end, this is one exercise that we'll do. This is what I call it's a 3 minutes breathing space. We do meditation every day. So the participants say, but doctor, sometimes we may be in a situation, for example, I'm a customer service. There's some people who are some unreasonable customers come to me and make all this unreasonable remark, and I feel so angry and want to break down or want to have outbursts. So what should we do? You cannot say, wait a minute, I do meditate. Of course, we have different techniques, like for example, take a deep breath or this thing. So we do teach this technique called 3 minutes breathing space that we encourage our participants to do on a regular basis even. And that is like every now and then doing a checking in and getting yourself back to your daily routine. It's although it's called 3 minute breathing space, you can do it 30 seconds, you can do it 1.5 minutes. It consists of 3 steps. All right. Basically, first step is, remember, it's like a hourglass shape of things. where actually there's a lot of things happening. And it's to create, first step is to become aware again, becoming aware of what is going on in your head, becoming what is your feeling like at this moment, and becoming aware of what is going on in your body, how you feel, whether you feel that your heart is beating very hard, fast, and your muscle tension is building up, you want to punch somebody. Yeah, this is the first step. And secondly, after you're aware of that, quickly, we narrow the focus down to using your breath again. Focus, bring your awareness just to your breath, your abdomen. This is, as I say, breath, you breathe. So breath is the best object to use for meditations. So this is a quick, and then after that, after you breathe for 30 seconds, 1 minute, you start expanding your awareness back to your whole body. In a way, it's a quick meditation, a quick fix for a situation. And why we do that? Because by doing this quick exercise, you get yourself, gather yourself again. You sort of recompose yourself again. And with that fresh mind, you can start making your choice. Because you remember, one of the things is many times things happen. If you are automatic, you will go back to your habitual response. All right? Because you may have, used to be like, your hot temper when someone irritates you, your immediate response is you shout back. If you have this, create this mindfulness, even sometimes a situation give you the sense that you're going to build up. You do a quick 3 minutes, you recompose yourself, and you make your choice, a conscious choice to what to do. So this is a good exercise. Do you want to practice it? We can just sit down there and do this. Okay. Shall we just... So it's very quickly. If you can do it in your office chair or whatever, so suddenly you just feel that even you don't have a situation, every time you just feel like you're a bit sluggish or you need to do something, you do this. So you quickly get yourself settled in. Close your eyes, or if your situation does not allow you to close. I tell you, there are some very skillful people who after that, they're able to do a quick 30-second breathing space. They share with me that they just don't say about that, but they maybe just gaze away and quickly take a few breaths, settle in, noticing what is going in through your mind. What's the thought there? How are you feeling now, your emotions? And checking in how's your body feeling, a quick scan, or whether you feel any tensions, any pain, or your heart beating very fast, whatever that. So take note of this, your thought, your feelings, and your body sensation. And next breath, start narrowing your awareness to take out your breath. You can use the abdomen as a focus of breath. And just putting your awareness there for the next 30 seconds. Just settling out, slowly expand your awareness to the rest of your body, from abdomen to the chest, to your lower limb, your legs, your feet, your chest, your neck, your head, and your body. Create a full awareness of your whole body. And when you're ready, just slowly open your eye. Do you feel the difference? Just a quick exercise like that, sometimes it's useful. We call it a 3-minute breathing space. And that, of course, we do also, in a later, we teach this simple technique and subsequently we use it to so-called breathing space with normal breathing space and breathing space with aversion when something happened. So these are the different practices that we do. Okay, so as I say, you want to really, what I thought is 3-minute mini space is things that you can practice also, a quick fix every now and then, but that shouldn't be the only thing you do. You can create your daily informal practices every day. Of course, the best is you can do it every moment, but we are not that good. So one of the things is you can choose to do is at least make a conscious effort and tell yourself, every day I want to do something that very mindfully and use that as a practice. For example, eating or brushing teeth, dressing, or combing, email, or if you have certain hobbies that you enjoy doing. In fact, that is the best thing. If you do it regularly. For example, as I share with you, I chose calligraphy. Whenever I do calligraphy, it's a mindfulness practice for me also. So if you say some people like to cross stitch, you can use cross stitch as a process of doing a mindfulness practice. So whatever it is, important things to remember is that it's to be every moment, if you can, mindfulness is a day-to-day things. All right, so we did talk about 3 minutes, and this Thich Nhat Hanh quote, while washing the dishes, one should only be washing the dishes. Which means one should be completely aware of the fact that one is washing the dishes. At first glance, that might sound a little bit silly. Why put so much stress on the simple things? But that's precisely the point. The fact that I'm standing there and washing this bowl is a wondrous reality. I'm completely myself, following my breath, conscious of my present, and conscious of my thoughts and actions. There's no way I can be tossed around mindlessly like a bottle slapped here and there on the wave. So, with that note, again, if the bottle, you can't stop the wave. If I happen to be the bottles, the Thich Nhat Hanh said, if you cannot stop the wave, you can learn to surf. John Kabat-Zinn. All right, thank you very much. Any question? If not, I think I'm quite good now, almost 5. Okay, good. Wow, I thought I finished more question. 糟了.
I have 2 questions.
Okay.
One is, where can I find the details for the run of your MBCT in June?
Okay, good questions. I think we'll post it at KTPH website. Khoo Teck Puat. Yes.
You can post it on the Facebook.
Yeah, okay, Facebook. Okay, when I have the detail. Actually, my staff is working on the flyer. I'll share through the Brahm also. Okay. Okay.
And then second one, how effective is mindfulness in dealing with paranoia? People with a history of psychosis
Okay.
and bipolar disorder.
Okay, bipolar disorder. Okay, paranoid or psychosis are people who have, when they're unwell during the psychosis, just for the other people, they may be hearing voices, what we call hallucinations, or they may have this paranoid or what we call delusions that people harm them, or they have other type of delusion which is not true. They may believe in something that is not true. And whereas bipolar is mainly a mood disorder, sometimes if bipolar, they have manic where they are going very high. This is the other extreme of depressions, and sometimes they will become depressed. Okay. For MBCT used in acute psychosis, probably not. But there are some clinicians and some researchers in UK who started using even MBCT for people who have hallucination. But they have modified the way it's being done, and they make it shorter, and they help them to live with their hallucination. Hallucination part, yes. Delusion, probably not. And for this group of patients, even when they are undergoing some sort of mindfulness therapy, they continue to receive medications. Medication is still the mainstay of treatment. As for bipolar, okay, bipolar is a mood disorder, but at its stand now, because it's something very biological, because of the chemical imbalance and causing the severe mood swing usually is not due to environmental. MBCT can have some role in sort of helping them to live with themselves, but I think whether they still continue with mood stabilizer, answer is probably yes. I just came back from a bipolar conference in Seoul. Yeah, is he working in hospital? Sometimes at this advantage, we get sent to overseas for a conference. There's one presentation on MBCT in bipolar. They are not, I would say they're still primitive. I don't, preliminary to say anything, but I certainly see the role of MBCT, at least for the preventions of the depressive episode, okay, because of the nature of MBCT, mindfulness practices. Okay, all right. Next question.
I'm working with the elder care sector.
Ah.
Now, I'm dealing with a lot with dementia patients.
Yeah.
How you see the significance of MBCT to be applied to people with dementia, or as a measure to prevent
dementia. All right.
from coming in so fast on elderly people?
Okay, I must say I have no experience on MBCT in dementia, although I do treat dementia, because dementia is essentially a deterioration of the brain. Whether meditation will slow down the process of dementia, I don't think there's any study on it yet, so I cannot comment. If you ask me, of course, if you are a meditator and you are having dementia, that at least in the early stage of dementia, it help you to cope with it better. This awareness, this accepting, and I think that is for that purpose. But itself whether have direct effect on dementia, probably we don't know. Probably not so promising. But on the other hand, I would suggest being mindful, the mindfulness practice may be useful for the caregiver for dementia, because it's a good way of dealing with the stress that you have looking after someone who suffers from dementia. Yeah. Okay, you may want to run a caregiver group. When doing the support group, you teach them some mindfulness practice and let them learn how to deal with all this distress that they have.
Doctor, I know someone who, after some mindfulness exercise, actually triggers some underlying pain, emotions, and trauma, and so intense that the person cried non-stop after it, and also got physical symptoms like gastric or that. So, isn't it possible to happen, and how to deal with it?
Yeah. Okay. This is precisely why we are very graduated in approach. Okay, so I'm talking, if you're talking about MBCT, yes, in the subsequent session 5, 4, 5, 6, we start dealing with the difficulty. In fact, the first 3 sessions are the easy stuff. The honeymoon is the 4, 5, 6 that we start having to get them to start talking about their experience and all this. So it really is not so straightforward. Therefore, the training, one of the requirements for MBCT, I'm talking about MBCT, teaching for MBCT and MBSR, is that the instructor, we don't use therapies, we say instructor, must have own mindfulness practices. Okay, and must go through the proper training. So, but of course, if it's all other form of mindfulness practices, meditation, teach by normal sort of meditation, they may not be able to handle that, because that's why important thing is MBCT is beside the mindfulness technique, is the construct of the CBT model help us to understand and help us to help the patient, the participant or the client or the patients to work through all those issues. Okay? Yeah. But on the other hand, we also are very mindful that MBCT is not the panacea for everything. We must know this limitation. And if there's someone who actually still acutely depressed, we usually would also not advise them to go for MBCT yet. Although there are some research now ongoing to look at MBCT for acute depression. That means someone is still depressed. All right. Okay. Yep. Any other questions? Oh, shall we last one?
Mindfulness, is it considered, mindfulness, is it considered Buddhist?
You missed my first few slides. It's not, what I've been telling you is all, this is a secular practices. It's not just for Buddhists. Of course, Buddhists do meditations. Catholic also do meditations, sister. Yeah. And we also know some Muslim friends also do meditations. Even some Methodist pastor also do. And so it's across religion. Mark Williams, the person who sort of develop this program, he was a pastor, Anglican pastor. So it's across religion. So in itself, it's secular. Yeah. And the things I teach, for MBCT, is all secular, and it was taught in university. And there are 3 universities very famous for mindfulness practices that research into mindfulness practices. One is Oxford, where Mark Williams came from. Second is University of Exeter. There's a Professor William Kaigan there. And then third one is Bangor University. It's a place where Niao Bu Sen Dan. I went there. It's really, I tell you a bit, but I don't want to digress. University of Bangor, they have a Center for Mindfulness Research and Practice, CMPR. In fact, they organize biannual mindfulness conference. Okay. So if not, thank you very much. I think you've been wonderful audience. About 80% still stay behind after 5 o'clock. Thank you.